hyperglycemia, that is maternal mortality, fetal mortality, and congenital abnormalities of the fetus that can be attributed by hyperglycemia in pregnancy, and importantly, if it is not appropriately addressed. Appropriate treatment of maternal hyperglycemia is found to reduce the such risk almost to the level seen in normoglycemic pregnant women. The importance of recognized and managing hyperglycemia in pregnancy is now well accepted, but still there are no universally accepted criteria for the screening and diagnosis of this condition in almost every country. Despite several guidelines laid down by various organizations, controversy exists on the optimal screening strategies and diagnostic criteria for gestational diabetes mellitus. The management approach for gestational diabetes mellitus also varies greatly, though lifestyle modification is universally suggested for such patients. The pharmacological management is not uniform, and the authorities are not in the same agreement. All this might have implications on the prevalence of hyperglycemia in pregnancy, maternal, fetal, and postnatal outcomes. In Bangladesh, the care of women with hyperglycemia in pregnancy is provided by a variety of healthcare professionals, including endocrinologists, obstetricians, gynecologists, internists, general physicians, family physicians, and so many. So we can expect that the uniformity will be low in those service care providers. But data on diagnostic and management approach of hyperglycemia in pregnancy is lacking here. The objective of this study was to assess the current practice of the doctors managing hyperglycemia in pregnancy in Bangladesh, and the results are anticipated to draw increased attention to their potential, but also to their limitations in gestational diabetes management. The subjects and methods. The survey has been conducted all over Bangladesh during November 2017 to March 2018 among the physicians, endocrinologists, obstetricians, internists, and others who were taking care of the women attending with hyperglycemia in pregnancy in Bangladesh. A structured pre-formed data collection sheet focusing on their knowledge and practice pattern on hyperglycemia in pregnancy has been sent through email and postage along with instruction to fill that up. And the questionnaire addressed the available screening methods for diagnosis of hyperglycemia in pregnancy, management including lifestyle, pharmacotherapy, and glycemic monitoring, potential perinatal care, and postpartum follow-up. In total, 975 physicians have been sent the instruction and questionnaire, and 262, around 24.89%, returned back with their filled up questionnaire. All data were descriptively analyzed by using Microsoft Excel version 2019 and then SPSS version 24. Now the results, a total of 950, I told the 950 doctors has been sent, and the 262 for 24.89% responded with their answers. Almost all, around 95% of them were aware of the high prevalence of hyperglycemia in pregnancy in the country, Bangladesh. The category of the physicians, we can see that around 42% were endocrinologists, around 31%. They were in the other groups, including internists, diabetes, family physicians, like that. And 27% were obstetricians and gynecologists who responded to the study. 262 responders, the majority 65%, 65.6% stated that all pregnant women should be tested, universal screening, and the 34% opined that only women with risk factors should be screened. 79% of them favored the early screening to prevent complications of hyperglycemia in pregnancy. Around 88% also stated that mild glucose intolerance in pregnancy in the first trimester should be tested during 20 to 24 weeks of gestation. And around 75% admits the usefulness of HbA1c in determining the gestational diabetes mellitus and pre-gestational diabetes mellitus. So while screening the patients with the hyperglycemia in pregnancy, what is the recommendation they are following? Around 64% follow the American Diabetes Association guideline. Only around 2% followed IADPSG guideline, and or around 2% follow the ACOG guideline, and this guideline mainly followed in this region, in the Indian region. Less than 1% followed the DIPSI criteria, and very fewer than followed the other criteria. While going for the question by question answered by the responders, they when they have asked the counsel, did they counsel the patient for the diet appropriate for the gestational diabetes mellitus? Most of them, around 87%, responded that they always ask for the appropriate dietary management. Advice for physical activity suitable for pregnancy. More than 50% advice for the physical activity appropriate for pregnancy. Asking support for nutritionist or dietitian for the management of gestational diabetes mellitus. It is more than 61% ask the help from the dietitian or nutritionist. Involve the family members and caregivers during counseling for the DDM women. More than 3/4 of the physicians admit that they requested the support for the caregivers or family members. And preferring drugs for the first-line treatment for gestational diabetes mellitus. Around 87% told that the insulin was the first-line treatment. More than 13% metformin, and almost 0%, nearly 0% for glibenclamide. Usual treatment prescribed, this is not in concert with their statement. The metformin has been prescribed by about 8% of the physician, glibenclamide 0.1%, but insulin was used by around 68% of the prescriber. Among them, premixed insulin 12.1%, split mix 13.8%, basal bolus 17.2%, and bolus only 10% of the responders. When they were asked continue metformin during pregnancy if the patients were on metformin before the pregnancy due to polycystic ovary syndrome or other condition, more than 1/4 of them intended to continue. Around 34% were confused. They sometimes continue, sometimes not, and around 40% did not continue any time. Prescribed oral drugs when patient refused or unwilling to take insulin. Around 14% of them prescribe other drugs, and another group, they were again was not with the fixed protocol. They tried to use insulin and then not added other drugs, and around 41% did not choose any drugs instead of insulin. Allowing artificial sweetener in pregnancy, around 42% allowed. Try to achieve and maintain the blood glucose target throughout the pregnancy. Around 3/4 of the physician tried, and around 1/4 tried sometimes, and infrequently they tried around 3% of the physician. Now, strategy of monitoring blood glucose postpartum. We can see that the pregnancy home measurement of capillary blood glucose by glucometer, it is about by 63% of the physician, and next to that, the around 34% of physicians do the periodic measurement of venous blood glucose in the laboratory, and urine sugar has been chosen by around 3% of the physicians. Now, delivery and postpartum care. Consider that the DDM women may require special care for delivery and postnatal period. Around 93% of the physicians agree with this. Preferred time of delivery, around 67% of physicians prefer that it is before 38 weeks, and around 29% they agree that it would be beyond 38 weeks of gestation. Preferred procedure of delivery, vaginal delivery was preferred by around 22% of the physician, and LAX was preferred by around 78% of the physician. Frequency of GDM patient followed up for the persistent of high blood glucose postpartum. This is not very high, only 46%. Now, coming to the test done for follow-up for persistent of high blood glucose at postpartum, formal ODDT 71.76%, only fasting blood sugar around 11.45%, random blood sugar 9.92%, and HbA1c 6.86%. Now, discussion. The screening and diagnostic criteria for gestational diabetes mellitus are still in debate, and discordance in preference in those methods are identified in different physicians. Once identified, those women can consider further tests. Healthcare providers can offer interventions that may improve the health and or of them or their infant. For gestational diabetes mellitus, the oral glucose tolerance test is generally the diagnostic test of choice. This test is usually administered at the first antenatal visit and between 24 to 28 weeks of gestation in the first test, if the first test is normal. The American College of Obstetricians and Gynecologists and UK National Institute of Health and Care Excellence, the NICE, recommend that women who have had gestational diabetes mellitus in a previous pregnancy should be offered diagnostic testing as early as possible after pregnancy booking in either the first or second trimester to identify undiagnosed type 2 diabetes mellitus. The Australian Diabetes in Pregnancy Society recommend risk factors assessment in early pregnancy. Risk factors are ranked by severity, and either one high risk factor or two moderate risk factors are needed before an ODDT is offered. We can see in the table. There is no national guideline for screening for gestational diabetes mellitus in Bangladesh, but most of the endocrinologists follow American Diabetes Association standard of care of diabetes management protocol here. In this study, around 53% of the physicians screen the pregnant woman following the same. One study from India found that 78.3% of the family physicians or physicians followed the national guideline in screening DDM in India. But 31.3% of the physicians did only fasting blood sugar to detect DDM here, which did not comply with the recommendations. WHO, SCOG, and DIFC criteria were followed up by 9.54%, 1.53%, and 0.76% of the respondents respectively. Importantly, around 66% of the respondents were in the favor of universal screening for gestational diabetes mellitus in Bangladesh, though they were not sure about the appropriate screening test for gestational diabetes mellitus to apply here. The neighboring India has the national guideline for it, and DIFC criteria is frequently used in India. More interestingly, around 76% of the physicians preferred for HbA1c in differentiating DDM and pre-gestational diabetes mellitus in the survey participants. The screening and diagnosis of gestational diabetes mellitus and treating it effectively not only prevent adverse maternal and perinatal outcome, but also future diabetes in both mother and child, so it should be emphasized. Whether method used, it is important to do universal screening in Southeast Asian countries and in Bangladesh, because we find that according to International Diabetes Mellitus or other publication published by our authors from Bangladesh, India, that this area have the higher almost second highest prevalence of gestational diabetes mellitus or hyperglycemia in pregnancy comparing other parts of the world. More effective and simpler strategies could be developed for future clinical practice for screening and management of hyperglycemia and pregnancy in this region. The most robust guideline for screening of gestational diabetes mellitus from the relevant authority is yet to come. The S multidisciplinary approach of gestational diabetes mellitus management has the undoubtedly proven effectiveness in predicting and achieving better outcome. All concerned gestational diabetes mellitus care physician should be brought to unified clinical approach to it, to screen or to manage. So at the conclusion, many of the physicians are aware of the adverse outcomes of hyperglycemia in pregnancy and advocates universal screening. They usually follow the standards of care of diabetes management recommended by American Diabetes Association, but universally they do not follow the same one. And some physicians like to continue metformin. Many of them dislike to continue metformin when the pregnancy is confirmed. About half of the gestational diabetes mellitus mother were lost to follow-up after delivery. So this is very important findings from the study. So we recommend as the pioneer study in Bangladesh to find out the approach to GDM of the responding physicians. Thus, the findings of this study may serve a baseline for the management of hyperglycemia in pregnancy in Bangladesh or countries like or similar geographical or socio-demographic patterns. We also emphasize that the doctors involved in management of hyperglycemia in pregnancy require more training for knowledge building and improvement of rational practice for the gestational diabetes mellitus or hyperglycemia in pregnancy. And we also very grateful that the article has been published in the International Journal of Diabetes and Endocrinology at the end of the December 2020. So thank you everybody for your patience attention to the to my publication. Now, if you have any question, I will be very glad to respond to your questions. Hello.
Thank you, Dr. Salim, for your presentation.
Hello. Yeah.
Our next oral presentation will be given by Dr. Azaman Roman from Russia.
Yeah.
Eastman Roman is a doctor of biological science, professor, honor worker of Science of Russia, head of the Department of Anatomy, Physiology and Safety, director of the Institute of Health and Safety. He is a member of 3 dissertation councils for doctoral thesis, a foreign member of the American Physiological Society, a valid member of the European Society of Pediatric Nephrology, and an associate editor of 2 scientific journals. He is the author of over 500 scientific and methodical works, including 28 monographs, 90 manuals, 367 articles in referred journals, and 16 proposals. Now I would like to call upon Dr. Azaman for his presentation on role of antioxidants in correction of carbohydrate metabolism in rats with diabetes mellitus.
Dear colleagues, do you hear me and is it clear?
Can you repeat again?
Do you see my presentation? Colleagues, have you seen my presentation?
No, doctor, it's not visible.
It's not visible. Just a
No,
moment,
no.
please.
Yeah.
And now, have you seen it?
No, it's not visible.
Can choose whenever has again when the screen here. I don't understand what's happening. Just a moment, please. I'm sorry.
Doctor, are you facing any problem?
Yes, now it's
Is it visible
yes,
right now?
yes.
Okay,
it's
thank you.
Thank you.
So, dear colleagues, the incidence of diabetes mellitus ranks in the same place after cardiovascular and oncopathology, significantly ahead of them in terms of growth every year. Currently, there are more than 347 million patients with diabetes mellitus in the world, and more than 600,000 cases of the disease are registered annually. According to World Health Organization, by 230, the total number of patients with diabetes mellitus will be on the planet. So at this picture, you can see so many adults comes with diabetes mellitus from childhood up to the adulthood. And you can see that diabetes mellitus is one of the great problems in the world. Hyperglycemia and diabetes mellitus is the main cause of vascular complications due to increase and the formation of reactive oxygen species and the development of oxidative stress. Therefore, it makes reasonable to use the antioxidants in the complex therapy of diabetes. In modern antioxidant therapy, various drugs are used, such as lipoic acid or tocopherol, vitamin C, vitamin E, selenium, etc. Here you can see the formula of different antioxidants like vitamin C, vitamin E, and the new antioxidant which is produced in our lab, and it's an artificial antioxidant which is very close to these both vitamins. This new artificial produced antioxidant is called selenophane. So this is selenium-containing phenol compound. Therefore, in this study, we tried to evaluate and to compare the effects of this new antioxidant selenophane, which was synthesized in our laboratory, in comparison with vitamins C and E, or the glucose concentration in the whole blood of these carrots, and compare with Alexan-induced diabetes mellitus rats. So, what was the design of our study? We used six groups of animals, three control groups, and three diabetic rats, three groups of diabetics. These were produced with Alexan injection of 0.1 milliliter per 100 body weight intrascapular. So the first control group was on the saline intake of instead of water, and regime, the usual regime of food and diet. The second control group was on the same regime, but it took antioxidants selenophane. The third control group was used vitamin C and E. Three control groups, three diabetic groups, were at the same regimes. One diabetic group, the fourth one, on saline intake. The second diabetic groups on the selenophane intake injection, and the third diabetic group on the vitamin C and D intake. So this was the design of our study. Let us give us a possibility to present you the results of this study. So here you can see the group control one, the second diabetic rats, and the third group, the group of diabetes, which used vitamins C and E. So you can see that in control groups, as on the baseline, in 1 day after the baseline, on the third and on the 6 days after Alexan injection, in control groups, there were no different changes compared to the base ground. In the diabetic rats, on the first day after Alexan injection, it was a significant increase of glucose in plasma. And this increase of glucose in plasma was at the third day and at the sixth day, but a little bit lower. The group of rats, diabetic rats, which intake vitamins C and E, as you can see, glucose increase was a little bit lower, significantly lower than in diabetic rats. On the third day after the injection, the concentration of glucose in plasma was also lower than in pure diabetic rats. And on the sixth day, there were no significant differences between these two groups, the diabetic rats and diabetic rats which used vitamins C and E. presentation. On the next slides, we would like to show you the effects of selenophane on some mechanism of regulation of carbohydrate metabolism. Here you can see the base group, and here you can see control one, the group control which used selenophane, and concentration of glucose in plasma did not change during the whole experiments. The third group, diabetic, that plasma glucose was increased on the first day after injection. And the fourth group, which used selenophane. So you can see the glucose concentration in blood plasma did not differ from controls groups and was significantly lower than in pure diabetic rats. Therefore, the first conclusion that can be made that selenophane significantly decreased the glucose concentration in blood plasma during the whole 6 days of experiment. While in rats which used vitamins C and E, the glucose concentration was a little bit lower than in pure diabetic rats, and only during the first and the second and the third day after the injection. So the first suggestion that we proposed that selenophane probably changed the deposition of glucose in liver or in muscles. Therefore, on the second stage, we determined glycogen content in a rat's liver during the whole experiment and to the end. Here, I would like to show you just results at the end of the experiment. You can see the glycogen content in the control group. When the control group used selenophane, glycogen content significantly decreased compared to the control. While in diabetic rats, glycogen content in the rat liver was significantly lower. Therefore, the conclusion is that diabetes in diabetic rats, the rat liver could not deposit glucose and could not transmit it into the glycogen. Therefore, the glucose plasma was significantly increased. But in rats which used selenophane, you can see a significantly increase of glycogen content in the rat liver. And it is very clear solution and a very clear conclusion that glycogen, that selenophane stimulates transmission of glucose to glycogen in the rat liver. The next suggestion was that selenophane could change although tolerance of tissues to glucose and can change the sensitivity to insulin. So on this picture, you can see changes of sensitivity to insulin of different tissues. At this picture, all data are presented as different to baseline to control levels. So when we injected insulin 2 micro units per kilogram of body weight, we found the decrease of glucose concentration compared to the baseline approximately 0.5, 0.7 millimole per liter. But in diabetic rats, injection of insulin did not change the sensitivity of the tissues to insulin. Moreover, you can see the increase of glucose in blood plasma compared to the control level. But in rats which used selenophane, sensitivity to insulin was at the same level almost that in control rats. Therefore, the next conclusion was that selenophane increased sensitivity of tissues to insulin, and by this way probably stimulate the effect of insulin decrease glucose in plasma. At the last stage of our study, we investigated the tissue tolerance to administration of 30% glucose solution. So when we give the additional glucose solution, we usually found the increase of glucose plasma approximately to 1 millimole per liter. And you can see that in control rats, increase of glucose plasma after the administration of glucose solution was almost 0.6 millimole per liter. But in diabetic rats, the same administration of glucose increased plasma concentration of glucose up to 3.5 millimole per liter compared to the basal level. In selenophane intaking rats, the increase of glucose in plasma was significantly lower than in diabetic rats. It was a little control ones that significantly lower than in diabetes. So the last conclusion that we can done from this experiment that selenophane also decrease sensitivity to the additional amount of glucose or increase the tolerance of tissues to additional intake of glucose. So from this study, we can make such conclusions. Selenophane, as a very powerful antioxidant, has a pronounced hypoglycemic effect, which is due to activation of glycogenesis in the rat liver, increasing of the sensitivity of tissues to insulin, and increasing the tolerance of tissues to glucose, while vitamins C and E had only a short-term hypoglycemic effect and probably did not change this sensitivity of tissues to insulin as well as tolerance to glucose, additional amount of glucose. I would like to thank my co-authors, Doctors Koroshenko Galina, Dr. Kozlova Anya, and Professor Kandalintseva Natalia for the taking part in these experiments and for the results which I present you now. Thank you very much, and I am ready to answer your questions.
For a wonderful presentation. If anyone have any questions?
Thank you, colleagues.
Thank you. I think no one have any questions. Now we are moving to our next presentation. Now we are moving to our Next presentation, which will be given by Samia Mahdi Ahmed, video presentation. Samia Mahdi Ahmed has a BSc degree in Medical Laboratories, Sudan University of Science and Technology in October 1997. She holds a master degree in Clinical Biochemistry in 2000 and PhD in Clinical Genetics in 2007. Her presentation is on the topic of effect of bee honey on blood sugar level of Sudanese patient with type 2 diabetes mellitus.
Nowadays, the medical world deals with the effect of bee honey on blood glucose levels in these patients. Diabetes, metabolic disorders, multiple disorder. Hello, everyone. My presentation deals with the effect of bee honey on blood glucose levels in these patients with type 2 diabetes. As you know that diabetes is a metabolic disorder with multiple disorders, etiologies, serious complications, and probably it is the oldest disease known to man. Nowadays, the medical world is turning more and more towards the health benefits of medical herbs and natural products. So honey is one of them. Honey composed of more than 200 compounds. For example, sugars, especially the monosaccharides, fructose, glucose, and also sucrose and other disaccharides, rich minerals and vitamins as well, like ascorbic acid, thiamine, acid, and others. Also, it contains many enzymes like those involving carbohydrate metabolism, diastase, amylase, and other enzymes, glucosidase, catalase, acid phosphatase, proteases, and others. Regarding the medicinal effect of bee honey, many studies show that honey has an antioxidant effect, hepatoprotective, cardioprotective, antibacterial, anti-inflammatory, and anti-tumor as well. Good patient and restricted diet may prevent or help from nutrients needed by the body, especially the diabetic patient complains from other problems. And usually they use artificial sweeteners. Now the question is that, can the patient use honey as a sweetener and get the benefit from its high nutritional value as well as therapeutic effects and use it as natural sweetener? So our objective comes to determine the effect of bee honey on blood glucose level of newly discovered Sudanese type 2 diabetic patients, those who were non-insulin dependent, and compared them with healthy control. Also to test if bee honey can be used as a sweetener. The sample of bee honey in this study was brought from an area in Sudan, hand-to-hand delivery from the honey collector, and the price of table sugar at that time was higher than the honey, so it is unlikely to be adulterated. The honey sample was analyzed to test its genuineness and to specify the main sugars, which are fructose, glucose, and sucrose. Usually, to test the genuineness of honey, the parameters that are analyzed are pH, free acidity, total acidity, hydroxyethyl peripheral, and water contents as well. Absence of hydroxyethyl peripheral is an indicator of honey quality since it is produced from fructose decay due to heating or bad storage of honey. Also, the main sugars in honey were analyzed and all showed that the honey is genuine. Volunteers shared in our study were fully informed by the aim of the study and written informed consent were obtained from all of them. Clinical examination was done and data recorded. Exclusion criteria is that all ill patients or apparently ill patients or those with complications or physical disabilities or were excluded from the study. So we have two groups, control and patients. Control included 10 non-diabetic healthy volunteers, 5 females aged 29 to 57 years, and 5 females aged 28 to 50 years. The patients classified into 3 groups. Group 1 contained 29 patients, 15 males aged 30 to 67, and 14 females aged 24 to 57. Group 2 included 21 patients, 5 males aged 30 to 59, 16 females aged 24 to 60. Group 3 contained 10 patients, 4 males aged 30 to 49, and 6 females aged 60 to 40. Actually, movement of patients in each test was according to circumstances surrounding the patient. I mean that some of them started the test and then they quit. They apologized to continue. Blood samples were taken from all subjects before tests were giving the doses, like hemoglobin and fasting blood glucose were determined. Then specific doses of either honey or a mixture of sugars that represent the same percentage that found in the honey. Also, glucose doses were given to both diabetic and healthy control. The test was as following. The first test, 108 grams of honey that contained 75 grams of sugars were given to the patients after taking fasting blood samples. Further blood samples were taken after 60, 120, and 180 minutes to determine the blood glucose level. A week later, the same test was repeated with an equivalent dose, that is, say 75 grams of sugar mixture containing fructose 41 grams, glucose 30.8 grams, and sucrose 3.2 grams instead of honey. Blood glucose levels were determined at the same time intervals mentioned above. Second test, a dose of honey was given, which is 36 grams. It contains 25 grams of sugar. And a week later, the same test was repeated with an equivalent dose of 25 grams of sugar mixtures. That to say 13.7 grams of fructose, 10.3 grams of glucose, and 1.1 grams of sucrose. The third test, glucose doses were given as 50 grams or 25 grams, then blood glucose level was determined as mentioned above. Now we are going to compare the results of the high dose of 75 grams of either honey or sugar mixtures and 25 grams of either honey or sugar mixtures or glucose and 50 grams of glucose. Regarding glycated hemoglobin, all patients but only one had normal glycated hemoglobin percentage. All the others had high percentage. Now to compare the doses, these are the results. As we can see here in this histogram, is a high dose of honey, which is 108 grams, equivalent to 75 grams of sugars. This is the fasting level, the blood glucose increased and then increased a little bit, but it's still higher than the fasting level. The same results we got regarding the high dose of sugars, which is 75 grams. At the end of the time, the blood glucose level is still higher than the fasting level. Also, the 50 grams of glucose showed the same pattern. Blood glucose level increases and then a little bit decreased, but still higher than the fasting level. Now, what happened regarding the low dose of 25 grams of either honey or sugar mixtures? Both honey and sugars mixture at low doses, they didn't cause significant rise in blood glucose after 1 hour, and the blood glucose level dropped below the fasting level after 3 hours. As we can see here in the histogram, the blue one is the honey, this is the fasting level, and at the end of the time, up to 3 hours, it decreases below the fasting level, as well as the mixtures of sugars that contain 25 grams. Here is the same result that we did as percentage. This is the fasting level of either honey or sugars. At the end of the time, they showed lower levels than the fasting one. And same thing occurred regarding the control. This is the honey and this is the sugars. Increases a little bit and then decreases below the fasting level, and then the low dose of neutralizes by suppression of high phosphorylase, then no more glucose is formed. Also, it is found that absorption of fructose increases when equal amounts, but just in moderate or low concentration of fructose and glucose. If they are given simultaneously, they will increase the absorption of fructose. Fructose also reduces food intake. That's in empty is pronounced by fructose intake, which may slow the rate of intestinal absorption. So it may reduce weight gain. Fructose also is found to stimulate insulin secretion, and honey is found to have a hormonal-like effect. It acts like insulin by itself. Some studies said that long-term honey feeding in rats will induce significant decrease in glycated hormone, hence growth and venous increase. From this study, we can conclude that green honey at low doses, equivalent to 25 grams of sugars, increases blood glucose level below the fasting level after 3 hours. Green honey supplementation in individuals with impaired glucose tolerance or who are at pre-diabetic stage may delay or prevent the development of diabetes mellitus. Now we can recommend that low doses of genuine honey, approximately 3 tablespoons, can be recommended for diabetic patients as a sweetener. Besides its high nutritional value, instead of using the so-called diabetic food, which offer no metabolic advantage and often have side effects. We can say that also we need further longitudinal studies, including more sample size. Are the references. And then I'd like to express my gratitude to my supervisor, Professor Idris and Bashir, and my family, especially my father, my husband, and to all diabetic patients and 8 years ago. Don't tell baby that to go to mountains and to trees to get nectar and to produce honey. And
May I ask a question?
Hello.
May I ask a question?
Yes, you can ask the question and we can forward the
Okay,
same
thanks.
to Dr. Samia.
Yeah. How can you explain the mechanism of anti-diabetic and anti-lipidemic effects of honey?
Professor Roman, thank you for your question. Could you please write the same in the in message box so that we can share the same with Dr. Samia. So that once we will get answer from her, then we will forward it to you.
Okay.
Okay, thank you. Thank you so much. Now we'll move forward our next oral presentation, which is given by Dr. Lisa Manis. She is from Western Salim State University, USA. So, Miss Lisa, are you in the screen? Dr. Lisa, are you in the screen? Hello. Dr. Lisa, you can go ahead for your presentation. All the best for your presentation.
Hello everyone. I think Dr. Lisa is having some network issue with her connection. So that now we will move forward to the next presentation, which is given by Dr. Huang Hui Lim. She is from Medical Acupuncture and Pain Management Clinic, Brazil. Huang Hui Lim, please on screen. Hello. Hello.
Hi.
Yeah. Hi. Are you ready for presentation?
I was not ready, but I can try to present now.
Yeah, please try to present now. Thank you. Thank you so much.
Okay, Kachana, Salve. I will go inside the conference in my computer because I am with my iPhone and I need to go inside now, okay?
Okay, no problem. You can.
Can you see the data show? Can you hear me?
Yes, we can hear you. Please go ahead for your presentation.
Can you hear me?
Yes, we can hear you.
Can you hear me?
Yes, we can hear you. Hello everyone. Could you please unmute your video so that we can take a capture for the event? Please unmute your video. Dr. Ling, could you please unmute your video?
Can you hear?
Yes, yes, we can hear you.
Can you hear me?
Yes, yes, we can hear you. But we are unable to see your presentation. Now we see your presentation. Please go ahead for your presentation. All the best for your presentation.
You can hear me? Okay.
Yes, yes, we can hear you. Please, please go ahead for your presentation.
Sorry.
Yeah, no problem.
Okay. I will begin now.
Okay, okay.
Good morning, good afternoon, or good evening to everyone. My name is Juan Weilin. I'm a medical doctor from Brazil. I would like to thank the organizing committee to inviting me to this conference today to share two studies. The first study is entitled Chakras, Energy Deficiencies as the cause of sexual dysfunction in diabetic patients. The presentation today will be following what Hippocrates said, that it is important to consider other ancient medical traditions prior to the knowledge we have nowadays. So I will briefly explain how Western medicine treats sexual dysfunction in diabetes patients. Then I will show the traditional Chinese medicine point of view with one case report. One of the most common chronic diseases in almost all countries is diabetes mellitus and has been linked to sexual dysfunction in both men and women. There are several studies showing that having diabetes mellitus increases the risks of having sexual dysfunction by 3 times in men, and in women the same occurs, although it's not yet possible to find numerical data regarding the greater probability of women having sexual dysfunction. According to Western medicine, the main determinant of vascular and microvascular complications of diabetes is hyperglycemia, and these may be related to the pathogenic mechanisms of sexual dysfunction in diabetes. In addition, diabetics can present several clinical conditions, including hypertension, overweight, and obesity, metabolic syndromes, smoking, and atherogenic dyslipidemia, which are risk factors for sexual dysfunctions both in men and women. As a consequence of its multifactorial etiology, the treatment of erectile dysfunction in diabetic patients, men, require a global approach. And the first step is to correct modifiable risk factors and promote lifestyle changes, while the use of phosphodiesterase inhibitors represent first-line pharmacological therapy. At the moment, no specific guidance is available for the treatment of female sexual dysfunction in diabetes. Therefore, the therapeutic possibility for sexual dysfunction in diabetic women refer to changes in lifestyle, ideal diabetic control, psychotherapy, and selected drugs when appropriate. And diabetes belongs to the Xiaoke category in traditional Chinese medicine, and male erectile dysfunction belongs to the category of Yangshuo in Tcm. And Tcm believes that the erectile dysfunction lesions of diabetic mellitus are mainly in the kidney, deficiency of yin with internal heat, and stagnation of qi and blood stasis. It's the main pathogenic factor. And the case report that I will show you is a 62 years old man who has a diabetes treatment for the past 10 years and also has high blood pressure, altered cholesterol, and hyperglycemia. And this is unable to have sexual intercourse, has problems with memory and concentration. He makes use of the following medications. Shido X-ray 10 milligrams for diabetes, propanolol, hydrochloride, enalapril for hypertension, atorvastatin, ciprofibrate, and for cholesterol and triglycerides. And I did the chakras energy measurement of this patient, and all the chakras energy were in the lowest level of energy. In another article wrote by me about diabetes, all diabetes patients have this pattern of this disharmony, and the deficiency of this spleen is this battery here. This chakra is responsible for the stomach, the spleen, the pancreas function, and this is the chakra responsible for the pancreas function normally, and that's why here you can see that is not working properly. And this chakra is responsible for the thyroid and the breasts too. And but these organs, according to TCM, they don't work separately. They are connected by the energy flow. One organ is responsible for maintaining and for the energy of the other organ, but you can see that the spleen receives energy from the heart, and heart receives energy from the liver, and that they all don't have energy. That's why they don't have energy to send for each one. And that's why the spleen sends energy to the lung, and the lung sends energy to the kidney. And that's why in this treatment, we need to tone all the system, doing the Chinese dietary counseling to begin to absorb the nutrients adequately, because this 50 chakra deficient is the 50 chakra is the proper source of the entrance of the nutrients by ingestion of the foods. And if this meridian is imbalanced, the energy that has in the food cannot be absorbed adequately. And that's why we need to advise the patient to avoid dairy products, raw food, cold water, and sweets, because all these food can imbalance the 50th chakra or the spleen pancreas meridian. And also these kinds of food can imbalance the lead to more formation of heat, leading to more hyperglycemia, according to the article I wrote. And these kinds of food could induce the hyperglycemia too. The ingestion of fried food, egg, honey, coconut, alcoholic beverage, chocolate, melted cheese. These kinds of foods are orientation about the energy imbalances they can induce, and not by the components of these foods. Okay. And always, and here is that we need to advise the patient to avoid soda, coffee, and matcha tea in diabetic patients, because diabetes in TCM is related to yin deficiency, and yin deficiency is yin and yang are energy produced in the kidney, and all these foods and drinks can imbalance even more the kidney energy meridian, leading to less production of energy and leading to this way the diabetes formation. And also the sexual function is the responsibility of the kidney energy. And when we imbalance even more the kidney by drinking wrong drinks, you can imbalance even more this energy and harming even more the energy of this patient. And in the aging process is because of the lack of energy of the kidney. And the kidney normally begin to reduce the energy at when we reach 30 years. And after 30 years, we begin to decrease the kidney energy. That is why we need to maintain the kidney energy adequately to don't produce aging process, diabetes, or hypertension. Many diseases are related to kidney deficiencies. And here are the procedure that I used to treat my patients. The first was the Chinese dietary counseling. The second was I did the auricular acupuncture to establish, to balance the internal energy. Here I'm showing you some points that I usually use. The kidney is here, the liver, spleen, lung, heart, anxiety point to sleep properly, because all these points are very important to maintain the internal energy regulated. And here is the point to take out the heat retention, that one of the cause of the diabetes formation also. And here is the procedure called moxibustion. Is a tool in traditional Chinese medicine to transmit energy. Here is a kidney point. We are transmitting the heat energy, heat to the kidney that has lack of energy. And in this way, we are replenishing the kidney energy, leading to less formation of heat because of a lack of energy. And here are some homeopathy medications that I usually use to treat, to replenish these kind of deficiencies of energy. And this homeopathy medication this theory was created by me and published last year, entitled Constitutional Homeopathy of the Five Elements based on traditional Chinese medicine. I began to study homeopathy in Brazil in 2015 because I have some problems to find the Chinese herbs to treat these kinds of patients that has energy, internal organs deficiencies. Because in China, they usually use Chinese herbs to treat these patients. And here in Brazil, we have Chinese herbs, but it is more difficult to find. And that's why I began to study homeopathy. And after this course, I wrote this theory linking homeopathy with traditional Chinese medicine, because homeopathy nowadays doesn't, it works very well, but the physician does not know the mechanism of the action. And here in this article, I'm explaining by traditional Chinese medicine how could be the flow of energy using homeopathy. And that is why you, if you are a Western medicine physician, you can use this kind of treatment too, to treat your patients that has diabetes and sexual dysfunction. And if you replenish these chakras energy, because the kidney is responsible for the sexual function, and you, as you said, you saw in the radiesthesia procedure, the patient didn't have any energy in this chakra. That is why if you need to tone the kidney, you need to tone all the system, including, because the lung is the energy who sends energy to the kidney. And usually I begin the prescription using silicea, and after I prescribe natrium muriaticum, and after I prescribe phosphorus, after I prescribe sulfur, and after calcária carbônica. You need to prescribe the medication according to generation cycle of the 5-element theory. And with the treatment, he's feeling many better in relation to health, calmer, and peaceful. But the sexual function is not. He didn't improve yet because he began to treat only a few months. And to treat this sexual dysfunction is not so easy. You need to replenish this chakras energy, and if only these tools, it's very common, you need to use another tools too. But these are the steps that are very important. If you only treat the symptom but you don't replenish these chakras deficiency, you will not treat the root of the problem. And the cornerstone of all my treatments came from the treatment of this patient. Is a 70-year-old male patient that I treated in 2006. I will briefly explain his history to you to understand how I do this treatment nowadays. And this patient was suffering from leg pain for 6 months and had no improvement with any anti-inflammatory medication in 2006. And he was diagnosed with kidney yang deficiency, because yang deficiency is when the patient feels colder in the lower limbs. So I started treatment with Chinese dietary counseling, systemic acupuncture, and auricular acupuncture with apex ear blood gelatin. And here's to show you that in this case of Western medicine usually treats the leaf level, the symptoms. The diabetes is in the leaf level, in sexual dysfunction is in the leaf level. But what I'm treating in this tree is not in the leaf, but at the root of the tree that are usually not seen by the naked eye. And in this root, there are two theories in TCM that are yin and yang theory and the 5-element theory. And traditional Chinese medicine always considered the influence of the external pathogenic factor leading to the formation of the disease, such as the influence of the cold, the wind, the heat, humidity, and dryness. And you can see here that yin and yang are you need to balance this yin and yang energy in all the treatment to achieve health, yin and yang in the same height. And when there are some imbalance between these energies, there is a formation of the disease and symptoms. Here is to showing you the relationship between yin and yang, qi and blood. This theory is the main theory that I usually use to treat all my patients in all kinds of the disease, because all disease came from this imbalance. And yin and yang is formed by the second chakra, qi is formed by the first and fourth chakra, and blood is formed by the fifth chakra and controlled by the third chakra. that is very important to treat the chakras energy deficiencies, because if you don't treat that deficiency, you are not treating what is caused the diabetes, what is caused the sexual dysfunction. And when the patient usually have these deficiencies, and that is why you need to balance these internal energies to reduce the formation of internal heat that is the cause. The cause of the diabetes formation in TCM is indeficiency and heat retention. But there are every diabetic patient has their own energy disturbances, and they cannot have only these deficiencies. They could have the combination of these deficiency, indeficiency, young deficiency, blood deficiency, or indeficiency with heat retention. But the main source of the formation of diabetes is indeficiency and heat retention. Here are the 5-element theory that I am demonstrating that all internal organs are interconnected by the energy flow, and one element is responsible for one external sensorial organ. For example, liver is responsible for eye and vision. Fire is the heart, is responsible for the communication, and the spleen is responsible for the taste, and lung is responsible for sense of smell, and kidney for the hearing process. And when you treat some patient with the difficulty of hearing, you need to, if he don't have anything in the ear, it's probably is because the kidney energy or the second chakra does not have any battery, and you need to treat and replenish this energy to allow him to hear again, for example. And this anosmia and lack of taste is very common nowadays in the patients with COVID-19, because all these patients do not have energy in any of these chakra, but this is spleen, the lung and the stomach and spleen are the two main organs affected by the COVID, because they are at the top of the infection. They are affected the first. Here's to show you that diabetes can have many different manifestations. If the heat is in the upper burner, the patient can have more thirst sensation. And if the heat is on the middle burner, affecting the spleen, stomach, and small intestine, it can express excessive hunger. And when the heat is in lower burner, it is related to the patient can have excessive urination. Here's to show you that this chakra is the main chakra responsible for the indeficiency in diabetes, and also the energy affected in sexual dysfunction, and also in men and in women. In women with sexual dysfunction, woman does not need to have erectile of the penile, but she usually doesn't have a desire to have that sexual function, because she doesn't have energy. Also in men too, they don't have desire to do anything because they don't have energy. And that's why if you replenish this energy, you will improve all the energy, and all the whole body will improve, and also the desire to have sexual function will normalize again, also in men and in women. Here is the chart demonstrating that you need to follow this sequence of generation cycle when you are treating these patients. And here's to show you that the production of blood is made by the fifth chakra and controlled by the heart, the third chakra, and the blood is stored in the liver energy. And here's to show you that Chi is the vital energy in homeopathy physicians, and is called the prana in Ayurvedic medicine. and its chi is controlled, the distribution of chi by the lung and the liver, the fourth and the first chakra. And also you can see that here all the systems are in the lowest level of energy, and that's why this is the cause of the formation of diabetes, and the formation of sexual dysfunction is related to energy imbalances. Here I'm showing you again the Anschutz law. Why I'm using high diluted medication? Because according to this law created in 1888 by two German researchers, they are showing that when you use highly concentrated medication, in this case, any medication, high concentrated medication, you can reduce the vital energy of this patient, aggravating the deficiency of energy that I demonstrate that these patients have, leading to more formation of internal heat. In this case, can aggravate the diabetes and also the sexual dysfunction, or can have, if used chronically, can have a lethal dose. And why I'm using high diluted medication? Because according to this law, high diluted medication can increase the vital energy, can increase the energy of the internal organs that I showed that are in the lowest level of energy. And here's to show you that all the chronic disease nowadays has these chakras energy deficiencies. And the use of this kind of medication used by Western medicine can harm even more the vital and field, because it's considered high concentrated medication. In this case, as you saw in many cases, the patients that can use this kind of medication can lead to myocardial infarction. And here I'm showing you that in this publication I wrote the energy correction of energy imbalances in preventing and treatment of myocardial infarction. And in this case, patients with myocardial infarction without arterial obstruction, all of them have chakras energy deficiencies. And that is why I am saying that if you use this kind of medication, you reduce even more the vital energy of this patient that are already low, and leading to myocardial infarction and other kinds of complications. Here's to show you the necessity of having the two kinds of medicine in mind, TCM and Western medicine, to understand better the cause of sexual dysfunction in diabetes patients. The conclusion of this study is that patients with diabetes and sexual dysfunction have chakras energy centers deficient in energy, and the replenishment of these chakras energy centers is an important tool to improve the condition of the sexual function in these kinds of patients. As said by Hippocrates, natural forces within us are the true healers of the disease. Thank you for your attention. Sorry for the problems caused by my presentation. If you have any question, I will be very happy to answer you. Thank you.
Hello. Hi, Dr. Wang. Have you completed your presentation? Hello. Hello. Hello, Dr. Wheeling.
Hello? Hi.
Then another presentation is there. Yes, you have two talks, no?
Ah, do you want me to present the second one?
Yes, another talk, keynote talk.
Okay. I will present
Okay, right
that.
now. Yes,
Okay.
yes, yes.
Okay.
We are waiting.
Okay. Can you hear me? Can you see the screen?
Yes, yes. Hello. Please share your screen.
Can you see?
No, no, no. We can't see your presentation. Please try again.
I can't hear you.
Please try again.
Now
please.
I will start to present the second presentation. It is about the chakras energy deficiencies as one of the cause of diabetes formation.
Hello. We can't see your presentation on the screen. Dr. Huang, could you please try again to share your presentation? Yeah, now it's visible. Now it's visible. Please go ahead for your presentation.
Can you see the data show now? And can you hear me?
Yes, yes, we can hear you and see your screen. Please go ahead for your presentation.
I will begin the second presentation entitled
yes,
Chakra Energy Deficiencies as one of the cause of diabetes formation. Diabetes mellitus is a reference of a group of the disease that affects how the body uses blood glucose. And glucose is a major importance for health, being an important source of energy for the cells and the major fuel of the brain. And regarding both types of diabetes, according to the International Diabetes Federation, a person dies from diabetes in the world every 6 seconds, and the World Health Organization states that the number of people with diabetes has risen from 108 million to, and it is increasing every year. And based on this growth rate, 1 in 3 North American adults will have diabetes in 2050. And diabetes type 1 is characterized by absolute insulin deficiency and dependence on insulin intake. And physicians believe the possible cause for type 1 diabetes are various dietary constituents or unidentified agents that initiate the command for destruction of insulin-producing pancreatic beta cells. And there is no cure, and diabetes type 1 is considered an autoimmune disease associated, and if not a directly immune-mediated disease. And type 2 diabetes is characterized by the body's inability to produce sufficient insulin for the body's requirements. And some physicians argue that type 2 diabetes is a lifestyle disease bound to obesity and sedentary lifestyle, and therefore can be managed through diet and exercise medication. And the age range of type 2 diabetes diagnosis is between 40 to 59 years old. And if not fatal, it can lead to impotence, amputation, kidney failure, blindness, and heart disease. And the pathology entitled diabetes mellitus in Western medicine is referred in TCM as Shao-Ke. The translation in terms mean wasting, thirsting syndrome. And the objective of treatment, both in Western and in traditional Chinese medicine, is the same, is to lower the blood glucose. However, diagnosis and treatment are completely differently. According to TCM, both diabetes type 1 and 2 are related to indeficiency and heat retention. And according to Western medicine, type 1 diabetes is an autoimmune disease. And according to TCM, all autoimmune diseases are associated with indeficiency. In Shao-Ke disease, Tcm term for diabetes was the name the ancient Chinese gave to condition of 3 excess and 1 loss. Here I show you in my last presentation, I won't repeat again, the upper burner, middle burner, and lower burner, leading to excessive thirst, excessive hunger, and excessive urination. This article I wrote about diabetes, why diabetic patient is still having hyperglycemia despite diet regulation, anti-glycemic medication, and insulin. And in this article, I'm showing different points of view regarding Western and traditional Chinese medicine, and what are the points that are different that we Western physicians needed to take attention, because regarding that, there are other diets that can leading to energy imbalances, leading to hyperglycemia condition. And also I wrote this article about gestational diabetes, also is related to chakras energy deficiencies leading to hyperglycemia state of the patients. Here I'm showing you a study I did in my clinic, that is study from 265 patients. 15 have diabetes, and in all these patients I measured the chakras energy centers of these diabetic patient, and also all have this pattern of disharmony, all have internal energy deficiencies, and one doesn't have the spiritual chakra. And when the patient has this chakra working, having energy, this is a better when they have the spiritual chakra working. And when the patient do not have this chakra working, this patient, according to our study, have more complications, because it will have more energy deficiencies, leading to more heat formation, leading for more diabetes complications.